Hi, I'm here with Kyle McAvoy, who's a nurse practitioner and bioidentical hormone expert at Pearl Women's Center. Welcome, Kyle.
Thank you.
Great to have you here. This is such an interesting topic, I think, for a lot of women, and I thought we would start out really with the difference between the hormones that we're used to having our doctors prescribe and bioidentical hormones.
Bioidentical hormones differ in that they are formulated from naturally occurring substances, and they look and act the same in your body as the hormones that your own body makes. And the difference for a provider like me is that I can use many formulations, such as topical creams, suppositories, patches, oral formulations, and I can also prescribe very specific dosing. I work with a compounding pharmacist who makes those medications, and I can be very specific in what I need. The synthetic hormones, on the other hand, are formulated by pharmaceutical companies, and they take hormones, but they manipulate them in a way that doesn't look exactly the same to your own body. And that can cause side effects that are undesirable and also some adverse health risks.
And I think the most important question for women is, how do we know when we need this kind of therapy?
That's a great question. I see women all the time coming to see me, and they come in thinking, I'm not sure if something's wrong with me or not, but I feel tired, I'm distracted, I'm irritable, my family can't stand me, I have no sex drive, my skin is dry, I'm having hot flashes, I can't sleep, I'm exhausted. Don't tell me it's all in my head. And I have to say to them, it's probably a hormone imbalance. Let's test you and let's see what's going on.
So if I'm going to come in as a patient and see you, talk me through that process a little bit. So what's going to be one of the first things that you'll do when we sit down together?
The most important thing for a patient to do is bring in a good patient history. Most of what we do in medicine is by a history. If you tell me what your symptoms are, when they're occurring, how long they've been going on, what you've tried, what works, what doesn't, that's going to help guide me, first of all, in the process. After that, I'll make a distinction in what tests I need to do. I often order a variety of tests. I use saliva testing primarily for my hormone testing. I'll test your estrogen level, your testosterone level, progesterone level. Those are the three big players. And I might also look at your DHEA and your cortisol levels. I might also order a vitamin D level. That's a very important factor, especially living here in the Northwest. We don't get enough sunshine. And so people are depressed and they're tired. I might also look at your ferritin level. That's a measure of your iron levels in your blood, in your bones. Those all have a big impact on how you feel. So I'll order those tests on you, and I'll bring you back in a few weeks, and we'll go over the results together, and then I'll formulate a plan of action.
And so then you've kind of guided whatever my needs are, and then we start on a patch or a cream. There are many different ways to go about that. What happens then that we've gotten to that point that you've decided what my history looks like and what it tells you?
Well, I also look at women, so I start a treatment plan that we agree on together. Every woman has their own needs, and every woman has their own treatment plan that's individualized for them. So it's not in a box, it's not on the shelf. It takes some time to formulate. I also will make some suggestions for you, because these things don't happen accidentally. They happen because of genetics and age, environmental factors, lifestyle. I might make some suggestions to go on a certain kind of diet, take a certain kind of vitamin supplement. I try to do a more holistic model of healthcare. Then after we do that for a few months, I bring you back, and I ask you, how are things going? Is it working? Majority of times, people do see a great improvement, and it's very rewarding for me as a nurse practitioner to say, this works. And sometimes it doesn't, and I have to make some adjustments. I might need to do some more testing. I don't guess and treat, I test and treat. There's a big difference.
And I just am curious about what are some of those things that are suddenly turned around and you go, wow, I love the way I'm feeling. What is it, energy that we're talking about? Is it a sex drive issue? Tell me a little bit about what that looks like when things are just, yes, that you've nailed it with these bioidenticals.
Well, women come in with almost a different aura about them. They have a brightness to them. I can see it the minute I walk in the door. I know whether I've been successful or not. I can see it in their smile and in their stature. They no longer have the mental fog. The mental fog is a big problem for women at this age. They think, what's going on? I can't do the same things I used to do. And now they can. They have energy. They have sex drive. They're interested in things they never were interested in for a long time. And they're patient with their children again. And and their family loves them.
Kyle, it's so interesting to find out a little bit more about bioidentical hormone therapy. I've been hearing about it for a while now, and I feel like it's something that I can add to my arsenal if I need it. And I wanted you to give us a little summary of what bioidenticals are, how do I know that it might help me, and what can I expect when I come see you as a patient?
And that's what is very exciting. I see women all day long in my practice, anywhere from their 20s to their 40s to their 50s, suffering from many symptoms of what I think are hormone imbalances. And by having bioidentical hormones available to me, which act in your body the same, look the same as your own hormones, I have another treatment plan that I can use for them. Women as young as in their 20s and 30s might be having PMS, and before they might be put on the birth control pill, which is synthetic and they'll have more side effects. The bioidentical offers them a much more individualized treatment approach. I see great results in my practice. It's been very exciting, and there's help for people who think it's all in their heads, because it's not.
Thanks so much, Kyle, for being with us.
You're welcome. Thank you.